Are you at the end of your pregnancy and you're getting ready to pack your bag for birth and you're wondering, what the heck do I need to bring and pack in this bag? Because many of us overpack and try to bring our entire home with us when you really only need a few basic items. And we're going to go over all of those items in this video. Welcome to the MamasteFit YouTube channel. I'm Roxanne. I'm a student midwife and labor and delivery nurse of over 10 years, and I'm going to be going over what I recommend to people to bring to the hospital when they are giving birth. And it is going to be the bare minimum basic edition of this. There are a few things that can add a little bit of flair to your hospital packing list, depending on what you have available. But this is going to be like the bare minimum with some bonus features of extra things that maybe you can add in. The very first item I normally recommend to most people is bring a pillow, a comfortable pillow, especially if you're going to be there for a long time, usually an induction perhaps, or like you're a first-time parent and this is going to be at least a 2-day hospital stay. A comfy pillow is the highest recommendation that I can get, because no matter how hard we try, hospitals, we lose pillows. And these pillows are not very comfortable. They're usually little flat pancakes. So pillow is my one top recommendation. Next on the list will be labor items that you're going to actually use during labor. Put in like a separate bag that you can bring in just for labor and then switch out the bags once you've had baby. So you can put anything that you think you'll need for labor depending on what your goals are, epidural or unmedicated. I usually add in personally a TENS unit and maybe like some sort of rebozo to kind of help with labor support, but you can add in any of the items that you want to use, such as a heating pad, a birth comb, massage oil, anything like that. You can also add in a Bluetooth speaker if you have a specific playlist, but those are like things that would be in a labor-specific bag I would recommend. Now let's go over what I would prepare for the postpartum period. And you can see this bag. This bag is not full and it's not very large because the items I would recommend, pretty basic. It's not a lot. One, I personally, these are a little bougie items, but I personally recommend bringing a different peri-botter than what the hospital is going to give you. And then if the hospital doesn't have the disposable underwears, I would recommend disposable underwears over the mesh panties and pads. But personal preference, see which one you would like. This peri-bottle is what I normally recommend to people and my personal favorite that I use during postpartum. Because of this angle at the bottom, it's easier for you to squirt at your actual perineum and get all of the water in here without having to do some crazy gymnastics with the one that they give you at the hospital. But this is an additional expense, so if this is not in the budget, that's fine. But you can find them usually on Amazon for between $5 to $14 depending on the brand. This is Bottly's peri-bottle, but like almost every brand has some sort of peri-botter. Next, the disposable underwear. So you can again get these on Amazon. This is the Rail brand, but this is basically depends. It's like a diaper for you. I find it's just easier personally. So many hospitals do not have these in stock. So I would recommend to find out if they do, if you think you want to use them. And if you do, pack them in your hospital bag. But now let's get on to the very basic things other than that I would recommend you bring to the hospital. Number one, charger. Whatever phone you have, if you're not an Apple user, obviously don't bring an Apple charger. Bring your Android charger or whatever you need, but bring some sort of charger that is long, because the hospital, the plugs are usually a little bit far away from your bed. And if you find that you might want to scroll your phone or call people, you don't want it plugged in and be far away from you. So having a charger with a long cord that reaches the bed from where it's plugged in is probably number 2 top recommended items after a pillow. Next item is clothes to go home with. If you don't want to wear the clothes you arrived in labor, bring clothes and pack them in your bags. Other than the outfit you're leaving in, you can't just wear the hospital gown inside the hospital. But I would recommend also a robe. Having some sort of robe, because you're figuring out breastfeeding. You don't want to be just naked, kind of figuring it out, but having a comfy robe over the hospital thing kind of makes it feel more comfy and a little bit more cozy. So I always like to use a robe. So just 2 apparel items, really basic minimum, is 1, some sort of robe, and 2, an outfit to go home in. If you want to get additional, having a nursing bra can also be beneficial. We personally like Bottly's nursing bras in the immediate postpartum. This is Baobay's robe that I used personally in my postpartum period, but there are so many types out there that you could wear. If you don't want to wear a bra, though, that's also fine. You don't need to wear one. That's kind of like an additional thing. You can also just wear your regular nursing bras or regular bras that you wore into the hospital. Next, something for baby to go home in. Having some sort of outfit for baby to go home in. Maybe it is this MamasteFit infant onesie that she will wear home, but having some sort of outfit for your baby to go home in, because the hospital has the shirts that you can wear, but they prefer you not to bring them home with you. As well as just an additional thing you can add in other than just the onesies, you can have a little baby blanket depending on the weather of time that you deliver. If it's a little bit colder, having a blanket to cover baby in the car seat in before you go home is recommended and can be nice. Also, it should be self-explanatory, but you need to pack a car seat for baby to go home in as well. Lastly, and this is the last thing that I would recommend to add in, like mandatory basic kind of things, is hygiene items. If you want a specific toothbrush, if you want a specific toothpaste, bring that. If you like a specific deodorant, our personal preference is the Primarily Pure in that postpartum period because you stinky. And it's a good thing. It's normal. But if you don't want the postpartum BO, some Primarily Pure deodorant is our go-to. But pack that in your bag because the hospital does not have deodorant. And if you want body wash, I also prefer the Primarily Pure body wash, but bring your own body wash because the only things the hospital is going to have, including shampoo and conditioner, is baby shampoo and maybe some like older, not great shampoo and conditioner. If you're in a pinch, they'll have something for you. But if you want your own stuff, that's what I would recommend packing in your hygiene bag. So shampoo, conditioner, body wash, some good deodorant if you want Primarily Pure, MamasteFit, and then toothbrush and toothpaste. We will give you a toothbrush and toothpaste if you forget it though. And so that's just going to be basic. But if you have your own personal toothbrush, so like these are my personal toothbrushes and toothpaste, then you can bring that in your little hygiene bag. So this is basic items that I would bring. So number 1, pillow. Number 2, labor items that you want to utilize if you want to use anything. Number 3, a phone charger. Number 4, an outfit to go home in, as well as a robe to wear around until you go home. If you want to throw in a nursing bra in that little category, go ahead and throw a nursing bra in. Usually, depending on how long you're going to be staying in the hospital, I'd say 2 per day. Next, I would say an outfit for baby to go home in, as well as maybe a blanket for baby to also be covered in the car seat. Number 6, a infant car seat, whether it's an infant car seat that you can bring into the hospital or one that's already in the car that you place baby into before getting discharged. And then last, some sort of hygiene kit for you to take care of your hygiene needs, or a toiletries bag. And this can include your partner's stuff as well. So if they need a toothbrush and they need to take showers, you can throw all of their stuff in here as well. If your partners don't include all of their items, they also need some clothes to go home in as well because you're likely going to be there. But their items, you can always go home and get them because they can leave. Whereas you are kind of at the hospital until you're discharged, so it's harder for you to go get these items than it is for them to just go home and get those items. And then items that I would just add into hospital bags for me personally is the disposable underwears. These are from Rail, or a peri bottle that has that little curve at the end. So Frida Mom, Bottly has them. There's so many out there and they're fairly affordable. But if it's not something that you want to grab beforehand, it's not mandatory that I would say you must add that. But the other items, I would highly recommend having those in your bag as well. Some additional items that I would pack, but they're not a requirement, is if you want to wear shower shoes in the shower, grab some shower shoes. If you want to take pictures, specifically of baby in certain things at the hospital. So like I did bring like a little picture board of Joan's name and her at birth time and birth weight, and got to take some pictures of her in the hospital bed with her going home outfit. So that was perfect because I wanted some really cute pictures in the hospital. And if you wanted to like coordinate your robe with the baby's outfit, I know Kaden Lane has like really cute coordinated outfits. But those are like extra things that you don't have to stress about having. But if you have time and you want to plan them out, go for it. Some people plan to have hospital photos taken. So a photographer comes to the hospital and takes their photos, and then having like maybe at that point, if you want to put makeup on or if you wanted to kind of do your hair, having those things in your hospital bag for those occasions would also be helpful. But pretty much everything else the hospital will have if you don't bring them. So they will have mesh underwear and pads. So you don't really need underwear at all. Like they're going to give you underwear. So you don't need any of the bottoms really for while you're in the hospital. They're also going to have the numbing sprays. So you don't really need to bring those as well. They're going to have ice packs for you. So you don't need to bring your own ice packs. They're going to have diapers for the baby. If you want specific diapers, then bring your own. But they will have diapers and wipes for baby, as well as some outfits and blankets for you to utilize while you're in the hospital until you go home. If you want to use your own, though, if you want to bring in your own outfits, like extra outfits and extra blankets, that's totally within your right. And if you want specific diapers and wipes, also add those into your bag if you have time. If you want to bring your own water bottle, you can if you have a specific water bottle you like, but the hospital will likely give you a water bottle to use while you're in the hospital. And then most of the time you can then take it home with you. Food-wise, you can bring snacks and pack that in your hospital bag, especially for labor. But if you're not in a rush and labor hits you suddenly, you can just rely on the hospital. They'll have breakfast, lunch, and dinner for you, as well as little snacks that you can grab from the nourishment room. And depending on the hospital, they may have some better snacks than others. But just to recap, what would I recommend bringing in your hospital bag, like bare minimum hospital bag? Number one, a pillow from home, especially if you're going to be there for a while. Labor specific items. So your rebozo, your TENS unit, whatever labor prep items you want to use. Phone charger to charge your phone that has a long cable. Clothes to go home in, as well as a robe to wear around, potentially in the hospital room. Maybe throw in a nursing bra. Clothes for baby to go home in. So an outfit for baby to wear, and maybe it is this MamasteFit onesie for your baby. We have them in black. A blanket could also be nice for baby. And then lastly, some sort of toiletries. So your toothbrush, toothpaste, which the hospital will have if you forget that. But shampoo, conditioner, body wash, and deodorant we will likely not have, especially if you also have a 5-step face routine like I do. They're not going to have your face routine. So add that into your hygiene toiletries kit. And then just some extra stuff that you might want to throw in is one, your peri-care items, such as the peri bottle that has the little curb at the end, or underwear if they don't have the disposable diapers pretty much for an adult. Those would be really nice things that I personally added in, as well as the extra stuff that you can add in if you want, such as the little boards that you can like announce baby's arrival. Like if you're having pictures taken, some outfits with maybe a little bit of makeup if you're taking pictures, if you have time for that. Obviously throw in your partners, same things, their own toiletries, their own outfits to like have as well. Some people will add in like entertainment, but you're not going to have time for entertainment. You're going to be sleeping or eating or nursing your baby or feeding your baby. You're not going to have time to read a book while you're in the hospital. And that would be pretty much what I would recommend bringing to the hospital for bare minimum stuff. There's extra stuff that you can add in there, but know that the hospital likely will have a lot of the things that you need. And you can always call ahead to see what do they provide for you to find out. Maybe they have the disposable diapers for adults and you don't need to bring your own. Maybe they only have the mesh underwear and pads, and that's fine for you. Like you are perfectly fine with that, but they'll tell you all the extra stuff that they would recommend that you can bring with you as well, because every hospital kind of has different things. But at a bare minimum, they're going to give you a peri bottle. They're going to have gowns for you to wear. They're going to have some numbing spray for you, ice packs, taking care of all of that peri-care items, as well as if you in a pinch need a toothbrush and toothpaste, food as well, water and juices and things for you to like nourish your body. They'll have those things as well. You don't need to bring those. And obviously they will have blankets and pillows, but the pillows are not great. So I would always bring your own. And if you're looking for a more thorough guide for maybe a little bit more detail than just the basics of hospital packing, you can check out the details below. We have a free birth planning guide that comes with both a birth plan as well as a hospital packing list of what to bring with you. That is a little bit more than just the nitty-gritties, basics that you need. And those will be down below. And if you're pregnant looking for more support, check out our online childbirth education course where we dive into the science of labor and birth, as well as discuss birth options and ways that your partners can also support you throughout labor and postpartum. And we also have fitness specific to the prenatal time period that comes in 2 different formats. We have an on-demand format where it's a video that you follow along with us, as well as our self-paced option, which is a list of exercises with demo videos that you kind of move through at your own pace. And that comes in a full version, which is 45 to 75 minutes, and a mini version, which is like 20 to 30 minutes. All of those fitness program options are available in a bundle with our childbirth education course and all of our other prep courses as well. So if you want to check out any of them, it's an additional 15% when you bundle them. And for watching this entire video, you can use code YouTube10 to get an additional 10% off, which is like 25% off if you get a bundle. It's basically free, and we would love to be able to support you during your pregnancies. If you enjoyed this video, please like and subscribe to our channel so you can be notified whenever we release new videos. We try to release at least 1 fitness video a week and 1 educational video a week. And if there's a topic that you're hoping to learn more from about pregnancy or even postpartum, comment it down below and we'll be sure to make a video for you.